So you want to know, is self-care testing good? Well, this video is all about self-care testing and whether or not it's good. Welcome to HEALTHdrum. I'm Dr. Bert Worstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health so you can be informed and in control of your medical needs. And if this is your first time on the channel and you like to get fact-based healthcare information, please hit the subscribe button for me. By the way, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. Okay, so let's get into it and start sorting fact from fiction. So what exactly is self-care testing? Self-testing is a self-care approach that empowers individuals to take their own samples, perform simple tests, and interpret the results themselves for many different types of healthcare disorders. You can buy a test or a test kit for a particular healthcare disorder online or at various drugstores. They are available for a whole bunch of various medical conditions. Commonly, you don't need a prescription and you can perform the test without a doctor's supervision. This is fundamental to consumer-directed care. So what are the benefits of self-care testing for various healthcare conditions? So this screenshot shows some of the benefits of self-care testing. It's convenient, cost-efficient, time-efficient, keeps your information private, and there's consumer empowerment through consumer-directed care. You're in control, your body, your rules. So are there any potential downsides with self-care testing? So there are some potential downsides of self-care testing. In particular, there may be concerns about reliability or accuracy. As well, there can be variability between tests from different manufacturers. You can get false positives and false negatives. You may misinterpret the results, and there's a lack of professional oversight. However, even tests ordered by medical professionals may deliver incorrect results, so any test that's abnormal, get it repeated a couple of times to ensure that the result is valid. If unsure, seek professional medical advice. So when is self-care testing especially ideal? So self-care testing can be especially ideal for high-value disorders such as raised blood pressure or hypertension. This is very important to prevent all the problems that can stem from having raised blood pressure, like cardiac disease and strokes. And self-care tests are ideal when approved by healthcare regulatory agencies, when the test has clear instructions, when the test is used for managing chronic conditions, and when finances or access to professional medical care is limited. And what about reliability concerns for many of these self-care tests? Some self-care tests have reliability issues. Those tests that are highly reliable include those concerning glucose, pregnancy, HIV, and COVID tests. Moderately reliable tests include thyroid and cholesterol tests, and low reliability and controversial tests are the food sensitivity, microbiome, genetic, mental health, and wellness tests, to name a few. You need to do your homework. What about the costs of these self-care tests? This next screenshot approximates some of the costs associated with the self-care tests. Low-cost tests include those of pregnancy, blood glucose, and COVID tests. Moderately expensive are the thyroid, cholesterol, and vitamin D tests. And those considered costly include those for genetic testing, microbiome kits, and sleep apnea. Also, these tests may be cheaper if bought online, and most of these tests cost far less than a doctor's visit. What about the need for prescriptions or telehealth appointments? Fortunately, most self-care tests do not require a prescription. This is the whole goal of consumer-directed care. There are a few that require either a telehealth appointment or a doctor's prescription, such as those for continuous blood glucose monitoring, hormone panels, and cancer risks. As well, lab-based tests and imaging studies at imaging centers routinely require a doctor's prescription, as well as some specialty evaluations such as urodynamic studies require referrals or prescriptions. Hopefully at some point in the future, lab tests and imaging studies will all fall under consumer-directed care and not require a prescription. And hopefully, many more medications can be available over the counter and not require a prescription. So let's now look at the various disease groups for which test kits are available. Remember, this is not a comprehensive list, so do your homework. So here we're looking at self-care tests for chronic health and metabolic conditions, especially in the US where there is a ballooning obesity rate. There are scales for measuring weight and body fat monitors. These tests can help you make appropriate lifestyle adjustments, a combination of appropriate caloric intake and moderate amounts of regular exercise to bring down your weight. And because of weight and body fat concerns, many people develop high blood pressure and adult onset diabetes. All of these medical conditions are preventable. There are many types of blood pressure monitors and temperature gauges, test kits for blood glucose levels, hemoglobin A1C, and cholesterol levels. Getting control of your weight, blood pressure, and blood glucose will go a long way to keep you away from doctors and avoidable healthcare expenses. So what sort of test kits are available for infectious diseases? Self-care tests are available for infectious diseases such as COVID, influenza and RSV, strep throat, sexually transmitted diseases such as HPV or human papillomavirus, HIV, syphilis, gonorrhea, chlamydia, and trichomonas, as well hepatitis A, B, and C. And there are many others that test for infectious mononucleosis, German measles, rubella, whooping cough, or pertussis. What about self-care tests for hormonal and reproductive health? So there are several self-care tests for hormonal and reproductive health, such as pregnancy tests, ovulation prediction tests, menopause tests, sperm analysis kits, and specific hormone panels for testosterone, estrogen, FSH, and thyroid levels. There are other tests available to check for urinary tract infections. What about neurological and mental health self-care test kits? Are they available? There are several self-care test kits available for neurological and mental health issues, such as cognitive screening tests. There are some genetic tests available, cortisol and stress hormone tests, tests for alcohol and substance use, as well as self-assessment tests and questionnaires for various other neurological and mental health issues. What about self-care tests to screen for cancer? There are several self-care cancer screening tests like self-exams of the breast that women should be doing to screen for breast cancer. Then there are screening tests for bowel cancer by taking stool samples. There are test kits to test for cervical cancer and human papillomavirus or HPV. These HPV tests for women are important as some of these viruses are responsible for cervical cancer. As well, HPV vaccination is available and young women should get this vaccine. Currently, there is no good HPV test for men. As well, there are test kits for prostate cancer, screening with the PSA or prostate-specific antigen. However, the PSA test for prostate cancer screening is highly unreliable. I have other videos about the unreliability of prostate cancer screening and prostate cancer treatment. And there are tests available for the BRCA gene 1 and 2. What about self-care test kits for nutrition and gut health? Are they available? There are several self-care test kits available for nutrition and gut health, such as those for food sensitivity, measuring IgG reactivity, tests for microbiomes, vitamin D and vitamin B12, as well as mineral levels such as iron, as well hair analyses for various conditions and for heavy metals such as mercury, arsenic, and lead. Again, if a test delivers an abnormal result, repeat the test first before doing anything else. What about self-care tests for lung function and heart issues? There are several self-care tests to detect sleep apnea and spirometers for measuring lung function, incentive spirometers, pulse oximeters, and EKGs. By the way, sleep apnea is a sleep disorder characterized by frequent pauses in breathing during sleep. Obesity is a major risk factor for sleep apnea, particularly obstructive sleep apnea, and losing weight can help combat sleep apnea. Once again, making the right lifestyle choices by adopting a healthy diet and getting moderate amounts of regular exercise are great programs for staying healthy and minimizing preventable healthcare expenses. What about self-care tests for genetics or ancestry? There are genetic test kits available that offer insights into your genetic predisposition for certain health conditions. These kits often use a saliva sample and can provide information about ancestry, traits, and specific genes linked to various health risks. Apart from self-care test kits, how else can you empower yourself for self-directed care? So it's important to realize that the availability of all of these different types of self-care test kits for various medical conditions has also been enabled by unlimited access to healthcare information on the internet, access to telehealth and access to digital health platforms, and you can do all of this from a smartphone without controlling middlemen or insurance plans. As well, there's been a rapid development of a variety of smartphone apps, such as those that can screen for skin cancer, and multiple various other apps for fitness tracking and diet tracking, and so on and so on. As well, there are now great AI tools such as ChatGPT, Google Gemini, Grok, WhatsApp, and Messenger, and you can use all of these to do plenty of homework about your medical conditions for self-directed healthcare. So let's review all the benefits of self-directed healthcare. So consumer-directed healthcare allows you to make your own healthcare decisions. It allows for privacy and flexibility of your choices, allows for cost savings by not having to pay for professional medical advice. It also saves time by avoiding scheduling and appointment delays while waiting for that professional medical advice. And it may reduce the chance of medical errors and over-treatment. So let's recap. In this video, is self-care testing good? You learned that there are many self-care tests available, that many of them do not require a prescription, and that this is all about consumer-directed healthcare. To learn more about various medical conditions, self-care, and digital health, check out these other videos.